Welcome to the Center for Health Affairs Centennial Celebration. I'm Dan Moulthrop. I'm the Chief Executive Officer at the City Club of Cleveland. The Center for Health Affairs is a great partner to us in a lot of our programming, as they are a partner to so many of your organizations and so many of you and so much of the work that you do. It's a thrill to be here, a pleasure to be here. I thank you all so much for joining us tonight. Tonight is really about celebrating, it's about celebrating the Center for Health Affairs and CHAMPS, but it is also about celebrating Cleveland. The Center for Health Affairs represents something that's very similar to what the City Club of Cleveland represents, and all of these centenary organizations that were established in the progressive era, a moment in time when people were really looking at our community, people of our community were looking and being reflective about our community and thinking, how can we make this a better place? How can we make every institution work a little better? What kind of new institutions can we create to support the growth of our community, to strengthen our community, and to ultimately pass on some greater legacy to future generations? We are the beneficiaries of so much that happened 100 and 120 years ago in Cleveland. And tonight we honor that. And we also honor the legacy that Bill Ryan has left as the leader of the Center for Health Affairs. I think everybody knows that he's retiring at the end of this year. And anyway, before we do anything, a big round of applause for Bill Ryan, please. If you looked at any point over the last year at the Center for Health Affairs website and you saw the timeline of sort of the healthcare industry in Cleveland that began in the early 19th century and continued to that moment in 1916 when the Center for Health Affairs was established, and before that when Metro Health was established, and before that when University Hospitals was established, and then moving forward to this moment, it's really remarkable what has happened in our community. And in talking with Bill a little bit beforehand, but also in watching from my point of view as another just one of many civic leaders in Cleveland, to see the way that our community collaborates across so many different sectors and so many different institutions. If you listen to folks in the media, or you listen to the rumors or things like that, all of these organizations are in competition with each other all the time. And that's just not true. And the Center for Health Affairs is truly a testament to that. It's a testament to the collaborative spirit that I've come to call the Cleveland Way. And the Center for Health Affairs has really led that charge. So we're really pleased to celebrate that with all of you tonight, that idea that we can transform our community through better collaboration, and that the Center for Health Affairs is really a leader in that. The other thing that we're doing tonight is celebrating a remarkable community gift made possible through this centennial year for the Center for Health Affairs. They decided to challenge themselves, and a lot of organizations, when they do their centennial, they'll sort of look at themselves a lot and they'll put themselves on the spotlight. And I think it's interesting tonight that it's me standing in front of you right now, not somebody from the Center for Health Affairs, although they'll be here soon, don't worry. But that they spent the year, they gave themselves a challenge, and they said, how much money could we raise for another organization? They don't do fundraising for themselves. They are supported by a self-sustaining organization, a very profitable organization through their for-profit lines of business. And they thought, how can we leverage that and engage the community around these issues that we're dealing with? And so tonight we're also celebrating a remarkable gift of over $300,000 to MedWorks. You'll hear from Bill. He's going to talk a little bit about that later on. But I want to tell you a couple of things about that gift and how significant it is. The Center for Health Affairs, the staff of the Center for Health Affairs contributed $30,000 of that. I don't know if that's the staff cheering over here for themselves, but you deserve it. That's great. It's really, I mean, that's really significant. And I asked somebody on staff too, like, to what do you attribute that? And she said that it's really a reflection of Bill's leadership and the generosity with which he leads. I also wanted to point out that the way that they raise those dollars too, in offering a matching gift to the community. So half of that, more than $300,000, comes from the profits from their for-profit line of business. Many people would take that profit and plow it right back into the business and grow it and things like that, and they do that, but they also know that it's an asset, and it's a community asset, and they can plow it back into the community, and perhaps that can actually help them achieve the mission more than just plowing it back into their own work. So a round of applause for that effort as well. So there's a couple of housekeeping items I'm tasked with informing you all about. There's this virtual event within an event thing, all of this Twitter stuff that's going on. On your printed program, there's information about what's happening when. I think right now we're in the middle of hashtag health innovation. If you haven't already done your hashtag thank you Bill, you should really get back to that. That was the first hour. It's never too late to thank Bill. I wanted to also start a trend of like selfie with Bill, like hashtag selfie with Bill, but then you can all start forming a line right now. But also, so that's going to be going on through the evening. Please do engage with that. It makes everything even more fun than what's happening. And I'd like you all to pull out your raffle tickets right now. And Louisa Gant is going to come up and pull out the winning raffle ticket. Woohoo! Give a round of applause, please. Thank you. Okay. Louisa, first, here, I got another microphone here. Will you please describe what it is that we're winning?
A Joe Hayden autographed football.
Right on. All right. And it's going to be a better year for the Browns. You're sure of that?
Sure.
Okay. All right. So, who's our winner?
Here. I didn't enter everyone. 925-0213.
0213. Who's got it? 0213. Woo! I can't throw it that far, so you gotta come up. Here. Let's bring her up. Okay. She's on her way.
Let's play a game of toss.
Let's get this. All right. Congratulations. Come on up. Can you verify the winning number, please? Let's verify that. Oh, my goodness. Yeah. There it is. They match. Congratulations.
Thank you very much.
Enjoy.
Thank you.
Do a Heisman. You can also now do a selfie with the football. All right. A couple of other quick reminders. I'm shocked that this is on the list of things that I have to remind you at an event related to healthcare. But this is a no smoking venue. So, in case you didn't know. And lastly, we are, of course, this dance floor here is not for my breakdancing demonstration, which is very late in the evening. It's actually for the dancing that's going to happen after dinner. So the band Shout, if you've never heard them, they're phenomenal. And they'll be entertaining us tonight, so please do stick around for that. And now it's time to introduce Bill Ryan. He's probably thinking, like, when the hell is Dan going to get to that? So, ladies and gentlemen, Bill Ryan, I was asking my friend John Corlett, what should I say about Bill Ryan? And he wrote back, ha! He said, that man has an opinion about everything. And then he also pointed out that he was both the director of Medicaid for the state of Ohio and the director of the Department of Health for the state of Ohio before he came to the Center for Health Affairs in 2002. I asked his staff, too, why. So I don't know how many of you know that the Center for Health Affairs has been on the list, ranked very high on the list of best workplaces in the region. The Plain Dealer does this every year. And I said, well, what's that about? And it wasn't a moment's hesitation. It's about Bill. Ladies and gentlemen, Bill Ryan.
Oh, sit down. If I were Paul McCartney, you should stand. I'm not Paul McCartney. As far as selfies go, if we're taking selfies, I need powder. You know, this is my part of the evening is really to say thank you to all of you for everything that you've done to make this and the organization a success. First thing I would say is I really want to give a big shout out to our platinum and presenting sponsors, the Cleveland Clinic, the Community West Foundation, and the George Gunn Foundation. They really understood what we were trying to do here. We, about a year ago, decided, hey, you know, we're going to be 100 years old and maybe we should have a party. And then we talked about how we were going to celebrate that 100 years and how we were going to really remind folks of how appreciative we are of them and the community for allowing us to do what we do. Quite frankly, an organization like ours doesn't get to do what we do without people allowing us to do it. And we wanted to do something that would change people's lives. We spent a fair amount of time talking about different ideas, and the staff at the Center for Health Affairs spent a lot of time talking about different kinds of approaches. And we began to spend more and more time talking with the folks at MedWorks. And they just do a really incredible job. They meet people where they are, how they are, and address their healthcare needs. And for so many of the people that they deal with, health care and the immediacy or the more long-term needs of healthcare are not the first things that they have to worry about every day. They worry about whether they have enough food to eat. They worry about whether they're going to have a house to sleep in that night. They worry about things that all of us take for granted, and the fact that MedWorks really does meet them where they are, how they are, and do that one thing or two things that ease their burden with regard to their health is just a phenomenal accomplishment and an incredible asset for the community. And so we wanted to acknowledge that, and we wanted to thank MedWorks for what they do for our community. The event tonight was planned primarily by a group of folks that work for me. They're referred to as the Centennial Committee. I want to thank all of them. They did an incredible job, as you can see, and our partner In Bloom Consulting really helped us to focus this. There are two people who in particular I want to thank out of that group. The first is Kirsten Creation, who really did an incredible job of helping us focus that notion of a community gift. And the other person is Louisa Gant. Now, Louisa was just up here a few minutes ago, and Louisa was just up here a few minutes ago, and I think it's probably obvious to everybody that she has a more important job right now than organizing this party. She's getting ready to have a baby, and Louisa, as of now, you are permitted to have that baby. You know, we talk about transformation through collaboration, and one of the things that I think is so important and so a part of the Center for Health Affairs is the people who have been involved with the organization through the years. I mean, you look at our board members, you look at our hospital members, you look at the people who work here, and there's an incredible roster of people with enormous talent. And just to give you a sense, I thought about three people as I was coming here today who have played an enormous role in our success from outside the organization, and I thought of one person from inside the organization. So the first one is Lou Stokes. I mean, Lou Stokes had a long history with our organization, and the thing about Lou was he was the epitome of the word gentleman. There was not a kinder, more thoughtful man that I have ever met in my life, and he gave enormous time and energy to our organization and never forgot where he came from and always worked to make the lives of people in greater Cleveland better. So, and Lou's no longer with us, but I just felt like I had to bring his name to the party. The other person, and she's no longer with us as well, is Donna Rigo. Donna Rigo was the chair of this organization for many, many, many years, and led many of the conversations about our transformation 25 years ago. Another person who worked tirelessly. Now, Donna, for those of you who didn't know Donna had a very debilitating disease. She had rheumatoid arthritis. She lived in pain her whole life and never thought about herself and never thought about, oh, woe is me. She was always thinking about other people and how to make the lives of other people better. The last person in the posthumous realm that I have to think about and thank is George Voinovich. George was my mentor. He was the guy who taught me what I know. I gleaned just a fraction of what he knew about leadership. I gleaned just a fraction of what he knew about how to treat people and how to interact with a community. And he served that role for me right up until the day he died. And I just really felt like I needed to bring him to the party as well. The last person is here tonight, so it's not all my friends are dead. The last person's here tonight, and this organization wouldn't be here today if it weren't for him. His energy, his innovation, his drive is what brought this organization through some of the most tumultuous times in healthcare in greater Cleveland. Dr. C. Wayne Rice. Where are you, Wayne? Stand up. Between Wayne and myself, and it skews definitely towards Wayne, between Wayne and myself, we've led this organization for 50 of the 100 years. It's an incredible testament to the organization. It's also an incredible testament to Wayne's ability to swallow hard and look the other way sometimes. I really just want to say how proud I am to have been a part of this organization for the last 15 years and to have worked with each and every person, whether they're currently working with the center or have worked with the center at some time in the last couple of years, during my tenure. It's been a great part of my life, and I will look back on it fondly. We're going to show a very brief video that will give you a better sense about who we are and how we work and the kinds of things that have happened at the Center for Health Affairs over the last 100 years. So we'll watch a video now. Thank you.
Wow, that was phenomenal. An outstanding 100-year history. I can think back to the days of C. Wayne Rice and involvement with John Mannix when I started in healthcare in the mid-1980s. I'm now the Chief Operating Officer. My name's John Mills at Fairview Hospital, at Cleveland Clinic Hospital. So Cleveland Clinic, Fairview Hospital, where we have 49,000 employees and 3,900 physician scientists. The growth that we have seen and working in collaboration, the C word is so important in healthcare, of knowing your communities and your relationships. I wanted to say a few words about Bill Ryan and his leadership. You saw it evident about people, its relationships, it's doing things. Deanna Moore, the Vice President for Corporate Communications, shared something with me that I thought was a little bit impactful about the relationships and the way we move forward off of that. And it had to do with Governor Voinovich, who was Senator Voinovich, who always would ask, how's Ryan doing? And sort of that way. So it's sort of the quip, let's talk about Bill Ryan. Bill is a very, very skilled negotiator. He's an adept listener. He has passion, he has vision, and he has that serving leadership that is so essential. And as a board member for the Center for Health Affairs, we see that evident in our meetings. We see the results in our community. Part of Bill's background is extensive, and that's why we're so blessed to have him return to Cleveland. He was the director of the Department of Medicaid from 1993 to 1996. Prior to that, or after that, he was the director of the Ohio Department of Health. He's very much involved in doing things. There's this acronym, AAA C squared Q. In healthcare, you can think about AAA C squared Q. Are services available? So Bill, in his role, talk about the availability of services. Well, of course, services can be available. They might not be accessible. Bill worked to ensure access, and we'll talk further about some of the access. And then the accountability, are the metrics. How are we doing against everything? The two C's, I'd like to put collaboration in there, should probably be C3, but it's really the cost and continuity of care. Very, very important work with the hospitals to help strengthen our relationships and improve our results and return to the communities that we serve. And finally is the overall the quality, and the quality is just everything's so important on that. So one of Bill's biggest achievements was advocating for Ohio Medicaid expansion. If we look at a chart in 2012 in the state of Ohio, you can see colors, and it would indicate 14 to 16% of the population not having insurance. If you move to 2014 or today, you see a lot lower percentage. People have insurance, they have access, and that's been something that Bill has worked tirelessly on, achieving access, one of the main components on that AAA C squared Q occasion. So he has a real passion for access and looking at different activities. And for a board level at the Center for Health Affairs, he had a dream about 14 years ago. His dream was to have $10 million in revenue, $1 million in profit. With the development of CHAMPS and other activities and expansion of activities on that, 2016, we're projecting $24 million in net revenue with a bottom line of about $7 million. And as Phil Mazanik said in the tape, we're serving so many areas across the country and have expanded the services, and that's been Bill's leadership with a great team moving forward. I think we talk about that passion and access moving forward. What the importance of that is, it's to MedWorks and the expansion and care of dental services for those that are underserved or uninsured still and need access for care. Every day in our emergency departments, we see a lot of dental problems in the ED, booming ED populations, lots of dental work. So lots of needs that we need to continue to address to move Cleveland ahead for the next 100 years. So for tonight, transformation through collaboration inspired tonight's gift to MedWorks. This gift is truly unique. It's unique that an organization would celebrate its own centennial by giving money to another organization. Pretty significant factor. It's unique that all of you represent people in the community, businesses, different social agencies, different support, individuals, everything coming together to collaborate, to move forward, and to make a gift that is rather significant. Pretty extraordinary gift, as we saw. And it's also unique that the mission of MedWorks so perfectly demonstrates transformation through collaboration. Their work transforms lives every single day. Since MedWorks' founding in 2009, and I think it's a little bit ironic that most of the hospitals, or many of the hospitals in Cleveland, developed around 1918, 1922 because of the flu epidemic. Parallel that with MedWorks. MedWorks scheduled their first event, and they had to cancel it because of the H1N1 flu epidemic. So that's a little bit ironic on activity with going things. But since that time, MedWorks has had an impactful 37 clinics serving more than 12,000 individuals with over 26,000 appointments and services made. Tonight, we have come together to move forward and enhance that impact. One more example of transformation through collaboration and the great work that people can do when they come together and share common visions and purpose. So I'd like to invite Bill Ryan and Zach Ponsky to the stage, please. On behalf of CHA and CHAMPS, we want to recognize this check for how much, Bill?
Looks like $311,010.
Outstanding, too.
My name is Zach, and I'm a MedWorks volunteer. I am so incredibly humbled to be here tonight, to even be considered for this grant tonight. It is amazing to me that after 100 years, the Center for Health Affairs would not only put their own organization aside for another, but that we were selected to carry that honor. And I stand here tonight as one volunteer representing over 3,500 medical, dental, and vision volunteers in our community. I stand here tonight representing our board of directors and our staff at MedWorks that really make everything that we do come to reality. You know, for us, this is a really, really big deal. When we started MedWorks, we really didn't know what the heck we were doing. We knew that we had patients that needed help in our community, and we knew that we had medical volunteers that were ready to step up and give up their days to come see those patients. So it was not rocket science. It was obvious. Let's put those two together. And we had gone through a lot of learning at our organization at MedWorks to really figure out what we should be for this community and continue to pivot and make sure that we're meeting the needs of the community as healthcare has continued to change. And through our strategic planning process, Dr. Mike Anderson led our strategic plan and brought in Bill Ryan many years ago to set our course. And to this day, we've followed that course. And I did not know that you were retiring, but I can tell you that you better be able to hide well, because we're going to hunt you down. As only MedWorks can do, we will find you. We need your brain to continue to help us set our course. I just was thinking about tonight and the Center for Health Affairs and the history that it's gone through over the past 100 years. And when it was founded 100 years ago in 1916, what the founding hospitals and leaders of those institutions thought at that time. And if we had to ask them what they would envision the Center for Health Affairs doing 100 years from now, and who they would be honoring at their centennial event, what would they think? And it made me think that I really evaluated what MedWorks is and the army of volunteerism that has been created. It's been a snowball of volunteerism in medical volunteers, dental volunteers, nurses, doctors. And as I started evaluating what those founders might have envisioned to happen this year, and what healthcare might look like 100 years from now, I realized that I think they would be pretty happy with the outcome, because our organizations, while we are just a little baby, and Center of Health Affairs is really what we want to be when we grow up, but when you look at what we do and our core beliefs and why we do what we do, why our volunteers come out after 80-hour work weeks at the hospitals, it's to advance people's health care and make people's lives just a little bit better, and to move the ball just a little bit forward outside of the day-to-day grind inside the private practices and the hospitals in our community. And I think that our organizations in some way actually are running in parallel paths as far as our missions to advance the wellness and health care of people in this community, one person at a time. And that's really what it's about. We are volunteers that just try to make somebody's life a little bit better. Not just from the clinical care they get that day at a MedWorks clinic, but from the emotional, mental touches that happen throughout with our doctors and our social workers, to really show these people that, yes, you got great clinical care today, you got a tooth extracted, you got a pair of eyeglasses, but we also sat down with you and we care about where you are mentally. And to me, it's very touching to be here tonight. It's very touching to kind of see this idea of transformation and collaboration of the Center of Health Affairs and how MedWorks could play its little teeny part in what the big mission of Center for Health Affairs accomplishes every day. Let me tell you about the gift. This gift is, first of all, comes with an enormous amount of social and civic responsibility that we are taking on as MedWorks. This is one of those points in a little small nonprofit that is transformational. Not just transformational for us as an organization, but transformational for the lives of the people that we see at MedWorks clinics. This is not a gift that is going into some general fund for an organization. This is a gift that will actually change so many individual people's happiness and daily life. For us, we're a small little organization. We've done what we can do with volunteerism. We have the largest army of volunteerism in this city. But for us, we never had a money to spend to really take it to the next level. And there is so much need for dental. From day one when we started this organization, and many of you in the audience were there, we faced a lot of resistance, and we really just wanted to move the needle, and we've done it the best we can, but we've never had the resources, and Dan, you were there too, we never had the resources to take it to the next level and make a tooth for somebody. Do you know what that means, to make a tooth for somebody? You come to a MedWorks clinic, we're going to take your tooth out because you're coming to us. The hardest part of your day is getting out of bed because you're either depressed or you don't want to deal with the healthcare system, but you got an abscess. You'll come to a MedWorks clinic, and we'll take your tooth out. But we've never been able to make a tooth. Well, what does that mean, to be able to make a tooth? That means that somebody can smile. It means that somebody can get out of bed and feel good about themselves. It means that somebody can go on a job interview and actually get the job. And this grant is about restorative dental care, and it allows MedWorks to really take this pivotal point for our organization to now go into restorative care, make teeth for people, and make fillings for people, and do sealants for kids, and really do preventative restorative care. This is a big deal, and we have thousands and thousands of patients that are just waiting for this, and we've never been able to offer it. So on behalf of our volunteers, on behalf of our patients, on behalf of our staff and our board, we're just so humbled, and we will take this extraordinarily seriously. But I do have a call of action. Number one, I challenge all of you in this room to come volunteer at least one MedWorks clinic a year. We survive on our volunteerism. You don't have to be medically trained. Come be part of the Army. That's how we survive. My second call to action is my family was very touched by this award tonight. And while Center of Health Affairs, maybe they don't want your money on this evening because this is not about them, but we'll take it. So my family, for those of you who have not given to MedWorks yet, we will match dollar for dollar up to $25,000 tonight of anything that comes in. So I encourage you to stop at the table on the way out and help support the dental restorative mission that MedWorks is about to embark on, that Bill Ryan is going to help us set directionally correct. And I think there's a picture here that we ended on. Oh, maybe it's off already. But in the last picture of the slideshow, I just wanted to show you that that's our first patient. We saw this patient at Neon through one of our incredible partners who's here tonight, Dr. Foster. Billy Foster has just been incredible dental director at Neon, and without MedWorks partnering with organizations like that, we wouldn't be able to survive. But that partnership has allowed us to provide our actual first dentures, they're called flippers, partial dentures, I don't know. But they have allowed us to provide it for the first individual patient at our last dental clinic. So the mission is off and running. And the last thing I want to say is, which is very much in what I think the founders of Center for Health Affairs had in mind, which also, much like Center for Health Affairs at MedWorks, we demand that if you're a doctor or a nurse or a technician and you work at one of the main hospitals in our city, this is the day to collaborate. And this is the day that you must leave your logos at the door. Do not bring your logos into a MedWorks clinic, because when you come to a MedWorks clinic, we don't care if you're UH, we don't care if you're Metro or Cleveland Clinic or St. V's or the VA. You come, you share an exam room with a doctor from maybe the competing hospital. And that's what MedWorks is about, and that's what the Center for Health Affairs is about. Thank you so much. We really, really are grateful.
Zach said he's going to try and deposit that in the ATM outside. While Zach was talking, I was checking out my phone to see like how easy it is to make a donation at medworksusa.org. Is that right? medworksusa.org. So I'm guessing that if you have no time for tables in the atrium and you would prefer to simply do it online, you can do that right now. There's a little button, there's a little menu at the top. It's like 3 bars. Hit that, you'll find the donate button, and you'll be on your way. I want to say too, just from my point of view, that this idea again that the Center for Health Affairs, in their mission to enhance the communities and help hospitals enhance the communities surrounding their own organizations, that they would choose to create this sizable contribution to MedWorks, who is addressing in their work probably the most important challenge and the greatest challenge that we face in our community with regard to healthcare, which are these structural inequities that contribute to poor health outcomes for our communities of poverty and communities of color. I think it's a very powerful message, and it's just a striking example of the kind of leadership that we need to see more of, that we're seeing a lot of in our community, and we need to see more of. And just as somebody who's an independent observer, frankly, Bill, I thank you for your leadership. The Center for Health Affairs staff, I thank you for your work. And Zach, I congratulate you and your team as well. A few other people to thank before we get to dinner. It's coming, I promise. But again, thanks to our sponsors tonight, our platinum donor, the Cleveland Clinic, presenting donors, the Community West Foundation and the George Gunn Foundation, and also in another continuing example of leadership, Bill and Karen Ryan for sponsoring tonight as well. And of course, the Huntington Convention Center and Global Center for Health Innovation, which helped out tonight as well. If any of you do want to make a contribution, of course, to any of these organizations, Center for Health Affairs or MedWorks, there's lots of people on hand who can help you out with that. And I would also like to remind you to join the online conversations, because they're fun, but even more fun is that the band is going to be out here in probably less than 10 minutes to accompany your dinner. So ladies and gentlemen, have a wonderful evening, eat well, and dance hard, party on. Woo! Congratulations. Happy birthday, Center for Health Affairs.